So let's talk about fat grafting. So fat grafting is one of these procedures in plastic surgery that has multiple different ways in which it could be done. And so it's important as a patient you understand the different ways, and it will help you understand how your doctor does it and why they recommend that way. So fat grafting is a procedure where we take fat cells from somewhere on your body and we move them somewhere else. So in particular, I'm going to be speaking about breast fat grafting in this video. So the way that we get fat cells is by liposuction. Liposuction is a procedure where we get this, and I'm sure you've all seen pictures of this. So this is what we call lipoaspirate. And the way we obtain the lipoaspirate is we numb the area up that we're going to take the fat with a dilute numbing solution called tumescent. And then we use some sort of liposuction, standard liposuction or power assisted, which is a vibrating cannula, to remove the fatty cells. And what comes out through the tube, I'm sure you've again seen all of these videos everywhere online, is right here. So what comes out is not all usable fat. So you don't really want to use all of this. So at the bottom here, this is just blood and that tumescent fluid. And at the top, you're going to have a mixture of both healthy fat cells that are going to be happy and thrive somewhere else in the body, but also broken and damaged fat cells that are liquefied. So every plastic surgeon has a different technique for obtaining the fat for fat grafting. So there's very simple techniques where you just drain off the fluid right here and utilize the fat at the top. And then there's very complicated techniques. There's all kinds of different devices that will wash the fat, remove the fluid, and surgeons have different preferences for this. In my opinion, they all kind of work the same. I've used all of them. I tend to like simple, but some surgeons love the complicated. So in general, typically about 10 to 20% yield for usable fat is what you're going to get. So if you have a container like this and you have 2,000 cc's of lipoaspirate, 10 to 20% of that is going to be usable fat that we can use for injections. Okay, so once you've processed the lipoaspirate, you end up with your usable injectable fat. And so that's what this big syringe is right here. And then you're going to put it into little syringes. And usually most of us use small syringes for injection. So if you're injecting into the face, you're going to use tiny little syringes like this. Into the breast, I usually use 3 cc syringes. I have friends that use 5, that use 10. That's pretty typical for the breast. And then for injections, other places in the body, sometimes even a 60 cc syringe, which is right here. Now, some surgeons don't use little cannulas, and they don't do this by hand. They actually use a power injector. So the same power-assisted liposuction device that we use can be utilized in a way to inject the fat more quickly. I don't do that in my practice, but there's lots of surgeons that do. So every single surgeon is going to have a preference of how tight or loose the fat is that they inject. So tight fat is typically very little water content. So just think of it as just the fat. And loose fat tends to have a little more fluid to it. And so some surgeons like the way that injects better. It's going to depend on your particular surgeon. And there's some people that actually don't really drain the fluid off. They just inject a lot of what that lipoaspirate was, which I don't think is a good idea, but some people do that. So when you're talking to a surgeon about how they do fat grafting, you have to take all these things into account. So if you see one surgeon and they tell you they're going to put 400 or 500 cc's in your breast, and another surgeon tells you 200, there's going to be big differences with how those surgeons are processing and injecting the fat. It doesn't mean the 500 guy is going to do a better job and you get a better take. He's just doing it differently. So the key to good fat grafting and great outcomes is doing it properly and not overdoing it. If you inject more than the area can support, a larger percentage of it will go, and if your body doesn't reabsorb it properly, that's what leads to the horrific complications, the big lumps of dead fat and oil cysts. So I absolutely love fat grafting. I think it's an amazing procedure that gives incredible outcomes. If you have any other questions or want to know more about breast fat grafting, let me know in the comments.